The increasing rates are bad news for the state, and they're even worse for hospitals. West Virginia's DHHR said that around 250 COVID patients are in the ICU. That's the highest the state has seen since the pandemic began. 7 News reporter Colin Roos is live with an update from WVU Medicine Reynolds Memorial Hospital, who says they were already struggling with a staffing shortage. Colin.
Catherine, WVU Medicine says they are managing to treat their patients who come in with COVID complications, but they're worried about where things are going. The hospital is already beginning to stop some of their elective surgeries that require an ICU bed, and they say those beds and ventilators that are in use are being occupied longer and longer. President Dr. David Hess isn't mincing words about the number of COVID patients WVU Medicine is handling.
We're very tight for ICU beds and critical care beds throughout the entire system.
According to Governor Jim Justice, West Virginia has the fastest acceleration rate of cases in the nation. While not all of them are severe, enough of them are to put a strain on the kinds of services the state's hospitals are used to providing.
Prior to COVID, in our ER here at Reynolds, you would be seen in 9 minutes by a physician. It's gotten much worse than that because of the surge of patients that have COVID and need to be seen.
Dr. Hess calls the Delta strain more aggressive early on than the initial wave of the virus. That's leading to younger patients who are becoming sick more quickly. When you combine that with traditional ER cases like strokes and heart attacks, Ohio County Health Administrator Howard Gamble says it becomes unsustainable.
And at some point, something has to give. Either you stop providing those services that the public's used to, and you just focus on pandemic services. And that's not where you want to be.
So why is the ICU load worse now than it was at the previous case peak in January? Gamble says last year's government restrictions put society into what he calls a cocoon, shielding it from COVID's worst effects. But with the summer came more movement, resulting in what we're seeing now.
When you have 20 to 30 to 40 cases a day in some parts of this state, it is just too much.
Those cases are high and still getting higher, but surprisingly, the rate of deaths hasn't risen at the same pace. Johns Hopkins University says the weekly death rate on January 10th in the state was 206, while as of September 5th, it remains at 60. Dr. Hess credits the better understanding of the virus health officials have learned in the last year and a half.
We've gotten better at monitoring patients at home. I think we've gotten better at treating COVID in general.
But he stresses that we're not out of the woods yet. Dr. Hess is clear that vaccinations will help hospitals and nurses get through this latest surge. Now, WVU Medicine Reynolds Memorial Hospital is also using a promising treatment for their ICU patients. It's called monoclonal antibody infusion, and it keeps your immune system from overreacting to the virus. They say if you do get COVID, reach out to your healthcare provider to see if you're eligible for it. Live in the 7 News studio, I'm Colin Roos, working for you.